हेलो, मैं हूँ राशि सहाय और आप देख रहे हैं मेडी सर्कल। टुडे ऑन our colon and rectal health awareness series, we have Dr. Veena Bhanushali with us. Dr. Veena Bhanushali लेक सिटी हॉस्पिटल थाने में एक एनोरेक्टल एंड जनरल सर्जन है और पिछले 5 सालों से इन्होंने इस रूप में काम किया है। वेलकम टू मेडी सर्कल डॉक्टर वीना भानुशाली।
Thank you so much.
भारत में लगभग 75% ऑफ द पीपल पाइल्स से अफेक्टेड हैं। पाइल्स यानी कि हेमरॉइड्स एक बहुत ही सामान्य बीमारी हो चुकी है जो कि हर एक उम्र के लोगों को अफेक्ट करता है। तो आइए आज हम डॉक्टर से जानते हैं कि हेमरॉइड्स आखिर होता क्या है।
So, thank you so much, first of all, for inviting me. I am very glad that I can help other people by spreading the information about the piles. Myself, Dr. Veena Bhanushali, I am a general surgeon and an anorectal surgeon as well. So, coming back to your first question, what are hemorrhoids? Correct? Okay. So, hemorrhoids, which are known as piles as well, are the swollen veins or the lumps inside the anal canal. Okay. There are in total 2 main types of the hemorrhoids which have been observed and as per the books. First is external hemorrhoid and second is internal hemorrhoid. So in external hemorrhoid, the piles which is exactly situated or located outside the anus, like a hard lump which is painful, which is swollen, is known as external hemorrhoids. And the internal hemorrhoids, which are located or situated inside the anal canal or inside the anal verge, you can say. Okay.
So, doctor, can you tell us some signs and symptoms of hemorrhoids?
Yes. So, about the external hemorrhoid, hemorrhoids are basically swollen, they are painful, they have irritation. Also, there is one type which comes under external hemorrhoid, which is thrombosed piles. In this thrombosed piles, what exactly happens is there is a thrombus, which is a blood clot, is formed inside the external piles. And then, because of the blood clot, which is inside the cover of the external hemorrhoid, the hemorrhoid becomes extremely painful. It becomes swollen. It causes severe amount of discomfort to the patient. The discomfort is in that amount that a patient cannot sit, cannot lie down, cannot walk.
Okay,
and about the internal hemorrhoids, as you said, internal hemorrhoids are basically painless because they are situated inside or above the entered line. So the cause or the sign, as you asked, could be bleeding without the pain, or you can observe the bleeding whenever you are going to sit on the part while passing the motion, whenever you are going to put some pressure to expel out the stool during the bowel movement. You can see blood either coming out with the stool or just before passing the stool or after passing the stool because of the pressure that we apply at the time of a bowel movement.
So, doctor, hemorrhoids के कारण क्या होते हैं?
बेसिकली कॉजेज में कारण, जैसे आपने पूछा, उसको हम कॉजेज बोलते हैं इन मेडिकल लैंग्वेज. So first and the very important reason is straining during the bowel movement. Second is constipation or passing the hard stool. Third, in females, pregnancy and the delivery. Then in general, low fiber diet or basically regular heavy lifting. These are a few of the main causes because of which the piles or the hemorrhoids can occur to any person.
So, डॉक्टर, क्या हेमरॉइड्स का इलाज जो है वो पॉसिबल है?
हेमोरॉइड्स का इलाज है, but there are few things that I would like you to know. First thing is hemorrhoids, as I said, hemorrhoids are swollen lumps or the swollen veins inside the anus or just outside the anal verge. Okay. So what happens is, if something has come out of the anus in the form of lumps, okay, it cannot go back inside. The bleeding, which is caused because of the piles, yes, the medicines are available to stop the bleeding. But if you ask me, can the medicines treat the piles completely? The chances are very low. For that, a surgical option is available. Nowadays, there is laser treatment, which is the modern technology in which laser hemorrhoidoplasty, a name of a surgery basically, laser hemorrhoidoplasty is there, which gives excellent results to the patient immediately after the surgery within a time span of 10 days. So, yes, hemorrhoids are curable with the medications. The possibility is very low, but with the surgery, definitely yes.
So डॉक्टर हेमोरॉइड्स की कॉम्प्लिकेशंस क्या है?
There are many complications of piles or hemorrhoids. First is anemia, which is very severe because every time if you are going to pass the motion and there is bleeding through the bowel, through the anus, basically, every time with the amount of strain you pass or the strain you put basically to pass the motion, every time if you are going to bleed via your rectum or the anal canal, there is going to be loss of blood. Also, the amount of blood which is going to pass through the anus with the bowel movement, you cannot count basically. You cannot count that. That how much amount of blood exactly are you passing on daily basis via the motions. Okay. So the first and very severe complication of piles is anemia. Then the second is basically blood clots. Like I said, there is one thrombosed piles category which comes under external hemorrhoid. So that is the one complication in which the thrombus gets or the clot gets formed inside the external hemorrhoid, and then it becomes very swollen and very painful basically. Then the third one is extra skin tags, like the extra skin can grow outside the anus and it continuously you will be able to feel that on daily basis at the time of passing motion or at the time of cleaning the area basically of anus, like uh, it will be bothering you. Okay. Then the next one is strangulated hemorrhoid. Okay. So the term strangulated hemorrhoid, as in, as I said, there are two main types. One is external, one is internal. External जो है वो ऑलरेडी बाहर ही होते हैं, तो दोज आर विजिबल, दोज यू कैन फील. बट जो इंटरनल होते हैं दैट यू कैन नॉट सी बिकॉज दे लाई इनसाइड द एनल कैनाल और द रेक्टम. तो जब हिमोरॉइड्स का टोटल 4 ग्रेड होता है, फर्स्ट, सेकेंड, थर्ड एंड फोर्थ. फर्स्ट टाइप ऑफ जो हिमोरॉइड है उसमें सिर्फ ब्लीडिंग होती है जब आप स्टूल पास करने जाते हैं. ग्रेड 2 में एक मास या एक लंप फॉर्म होता है जो एनल कैनाल के इनसाइड होता है, एंड जब भी आप स्टूल पास करने जाते हैं उस वक्त स्टूल के ही साथ या स्टूल के बाद वो एनस के अंदर का लंप बाहर आ जाता है, एंड एक बार आपका मोशन हो गया तो वो खुद से वापस चले जाता है. ग्रेड 3 में यही जो लंप है जो स्टूल के साथ बाहर आता है वो बाद में खुद से अंदर नहीं जाता, आपको आपकी उंगली से उसको अंदर ढकेलना पड़ता है तब वो अंदर जाता है. और ग्रेड 4 विच इज द प्रोलैप्स्ड हेमोरॉइड और द स्ट्रैंगुलेटेड हेमोरॉइड, उसमें ये जो पाइल्स का मास होता है वो रेक्टम से या एनल कैनाल के अंदर से बाहर आ जाता है और वो वापस चाहे आप कितनी भी कोशिश करिए वो वापस अंदर नहीं जाता. तो उस वजह से वो जब अंदर का पाइल्स जो है इनसाइड द एनल कैनाल का वो जब बाहर आ जाता है देन इट बिकम सीवियरली पेनफुल. वो वहां पर बहुत सारा स्वेलिंग हो जाता है, इन्फ्लेमेशन हो जाता है और कभी कभी वहां से बहुत सारा ब्लीडिंग हो सकता है. So these were basically few of the complications that I stated of hemorrhoids.
So डॉक्टर पाइल एरिया को क्लीन कैसे कर सकते हैं?
फर्स्ट थिंग, आपको जब भी आप स्टूल पास करने जा रहे हैं, एक बार स्टूल पास करने के बाद बेसिकली once you are done with your bowel movement, you have to clean the area with water thoroughly. Make sure that no amount of stool is stuck to your anal region. Okay. And once everything is done, you are sure that everything is cleared up, the entire area is clean with the help of water, then you can just take a tissue, like a facial tissue, which are soft, or the baby wipes. You can just dab the area and keep it clean like that. If at all people want to sanitize the area properly, they are not happy only by only applying water, then after applying the water or after cleaning basically thoroughly the area, they can also use betadine solution to clean the area, so that they could keep the area more hygienic. They can use betadine solution to clean.
ओके डॉक्टर, सो मेडिसर्कल में हमेशा हमारी यही कोशिश रही है कि हम हमारे ऑडियंस तक ज्यादा से ज्यादा इंफॉर्मेशन पहुंचा सके, और वो भी कम से टाइम में। सो इसीलिए आज हम एक रैपिड फायर सेशन कंडक्ट करेंगे, जिसमें कि आप
Okay.
1 और 2 लाइन में भी आंसर कर सकते हैं, या तो फिर यस और नो में भी जवाब दे सकते हैं।
Okay.
ओके डॉक्टर, सो माय फर्स्ट क्वेश्चन इज कि वॉकिंग करने से हेमोरॉइड्स में मदद मिलती है?
Yes, walking or moderate physical activity helps to stimulate the bowel movement or the bowel function, you can say, as well as it enhances the blood flow and the muscle tone. So yes.
ओके, सो डॉक्टर, क्या गर्म पानी पीना या गर्म पानी से नहाना हेमोरॉइड्स की कंडीशन और खराब कर सकती है?
So if you are asking that सिर्फ नहाना गर्म पानी से या गर्म पानी से फर्क पड़ सकता है, तो it is very unlikely कि उससे ज्यादा कुछ फर्क पड़ेगा. But sitting in a tub, like the term is sitz bath actually, sitting in a tub which lukewarm water definitely helps the patient. If the patient is sitting in the lukewarm water twice a day for 10 to 15 minutes, just by sitting in lukewarm water, that can help the patient. But if the water is very hot, then that may worsen the hemorrhoids.
ओके डॉक्टर, सो क्या स्पाइसी खाना या ज्यादा मसालेदार खाना खाने से हेमोरॉइड्स में कुछ तकलीफ होती है?
I can say that differs from person to person actually. Also, that depends on how much amount of spicy food the person is eating. If the patient is eating like less or moderate spicy food, the chances are very less. But if the patient is eating moderate to severe, like we can say very spicy food, then yes, that may increase the chances of pain and discomfort associated with the hemorrhoids.
Okay, doctor, thank you so much for coming to our show and sharing your valuable time and insights with us at Medicircle. It has been a pleasure having you on the show.
Thank you so much for inviting. It was my pleasure to share all the information that I could with the patient. Thank you so much.
Thank you.